welcome to Health Matters from Wyoming County Healthcare Center. I'm Aiden. This series introduces you to the people and partner organizations based in our building, so you know what's here, what they do, and how to connect. Today's guest is from Stonehouse Investment Management. We invited Stonehouse as our first guest because they helped introduce Wyoming County Healthcare Center to the community early through their podcast when we were just getting started. With me today is Bob Brown. To start, I'd love to help viewers understand who you are, what you do, and why you chose to support this work so early.
Thank you for inviting me here, Aiden. This is a privilege to be involved with this. And I'll just say my role at Stonehouse is one of a financial planner. I'm one of a strong team of about 27 people we have, and we help families all throughout Northeast PA, primarily just manage their lives and their finances, and a lot of that centers around healthcare. So it's great to be here. Yeah, and we're very, very privileged to be here. And I think I'll let you get to your next question, but that's who we are.
Interesting. For people who don't know you, what's your role at Stonehouse, and what kind of work does your team do in this region?
Yeah, so a lot of what we do is sitting down with individuals or families and walking them through how they'll afford the rest of their life, or how they save up for something going on in their life. And as I just mentioned, healthcare is such a big part of that, especially as we get into our 50s, 60s, and older. And so having this facility here is a big pivotal opportunity for us and for our clients. And so to be a part of that, that's what we're all about. And so I'm technically the first guy of that 27-person team. I'm the OG of Stonehouse, I guess, by default. But we have a great team of people, and we help people all the way from Scranton, Wilkes-Barre, all the way up to Towanda, Sayre, Troy, and beyond. So
interesting.
Yeah, it's fun work.
Yes.
Fun work. And I have to say, and this isn't on the script, but I'm so impressed of watching how you're reading.
Yes.
And it just blows me away that you're doing this. I feel super privileged to be next to you. Thank you for inviting us to be here.
Absolutely. When Wyoming County Healthcare Center was brand new, what made you willing to help share the project early before most people even understood what we were building?
I don't know if I'll be a real quick answer on this, but I will say the short answer is Bill Rourke. We started to feel it with our client base because they started to hit the panic button when Tyler was closing down.
Yes.
What happens to our healthcare?
I did too.
Yeah, and I think it was, I think we all, that old adage of, you don't know what you have until it's gone. And so we started to feel what that void would feel like.
Yes.
And when Bill approached me about what he and his family wanted to do, I sort of tried to talk him away from it because it was such a heavy lift. And I didn't know if he knew how much of a lift it was.
Yeah.
But he was very determined. And Bill and his family and the team around him had so much passion and drive, and I thought if anybody could do it, these guys could do it.
Yes.
And so I went to my partners and kind of relayed that story, and my other partners at Stonehouse, it didn't take much of convincing, and we got behind it. And we're very proud to be, by the way, we were part of a much larger group of people that supported this on the onset, but we're very privileged to be part of that group.
Yes. That early support matters. Now that the building is active and growing, I want to ask about what Wyoming County Healthcare Center is really doing for families.
I think the biggest fear that everyone had was that the care that we were used to getting and took for granted was suddenly gone. And they all want that back, overnight.
Yes.
And I think what we've all realized, I know the Rourke family and their team have realized, is that can't just happen with a wave of a magic wand. It has to happen in a series of steps. And so what I think people outside the building need to recognize is that they are taking those steps today to put those pieces back on the table, back as options for us.
Yes.
And today it might not be as much as everyone would love, but to get to some of those future stages, what they're putting in place makes sense, and it's what we need now today. And I love that they're working toward that long-term plan to continue to build and build. And I think sitting here with you right now today is probably a great example of that. This opportunity wasn't here before, and now you're sitting here running a podcast.
Yes.
And just about to turn 20 years old.
From your seat in the community, what problem is Wyoming County Healthcare Center helping solve right now, and why does that matter for families in Wyoming County?
I'm probably not the one to talk about everything that's going on in this building, because I feel like every week or so I touch base. There's another program being offered. We're doing a part of a seminar next week to help out with some things on emergency preparedness. And now the Facebook page is active, and there's just new programs and things like this podcast. It's getting the word out, and as they're building it piece by piece, I think they're doing, their team here at the healthcare center is doing a very good job of listening to what the community needs and trying to find a solution. And we can't have everything in this building, but I think the pieces that are being put in here make a lot of sense today, and we can build around. They're sort of the building blocks to get this thing going in the right direction.
I totally agree.
Nice.
If someone watching has driven past the building 100 times but still doesn't really know what's inside, what do you want them to understand in 30 seconds?
I can't say anything in 30 seconds. Well, I'll do my best. I guess I would say you can put any sign on the building. You can call it whatever, but the building is just an empty shell without the people inside. And I will say that, again, going back to my reason for encouraging my partners to get involved with this is Bill and his family and the team that they have assembled around them.
Yes.
Their heart is in the right spot, and they want this to happen because of the people in their community, friends and family they've grown up with. And to not have this here is quite frightening. Yes. So I think we're all very fortunate that they stepped in and tried to take a lead here and make this happen.
Yes, I totally agree. Thanks for putting that into plain language. And I also want to thank Stonehouse for sponsoring our emergency preparedness for seniors workshop supporting practical community education. When you think about preparedness for seniors and families, what's the one conversation people avoid that they really shouldn't?
What if I'm not here tomorrow? That's usually none of us want to talk about our mortality, but if I'm not here tomorrow, that's usually the question that goes unanswered or unaddressed, especially for guys. We don't like to admit that we're invincible, or that we're that we're subject to
Yes.
death and everything like that, but that happens.
Yes.
Death, disability, all those things happen.
Yeah.
And sometimes when you don't, what's the adage? If you fail to plan, then you're planning to fail.
Mm-hmm.
And sometimes little conversations, but important things can be discussed and planned out. And it doesn't mean you're expecting it to happen. You're just planning in case it
Yes.
happens. And those are the important things that people most often don't do inside their house.
Yes, I totally agree. If you could leave viewers with one simple reminder about planning ahead, something any family can do, what would it be?
Start today. I've been asked that question before in a different way, but it's people always say, like, when's the best time to start planning? And the answer is today.
Mm-hmm.
It's always better than it would be tomorrow, and you'll probably forget by tomorrow. So have that conversation, and don't be afraid to sit down. I just had this conversation with somebody this morning, planning out your future. Here's a good example. Let me back up real quick. See, I told you I can't say anything in 30 seconds.
Yes.
Real quick, if one of the most common things we see in our office is husband and wife, and one of them takes care of the finances and the other does not. When he or she passes, the surviving spouse has no idea what to do, how to do, or where everything is. And so some of the things we'll talk about in that seminar is getting all your ducks in a row and in places where somebody can find it if something happens to you. So those are usually the things. Those are easy fixes, but people tend to just never talk about them. So,
Yes, I agree.
all right.
Thank you, Bob. I appreciate you being here and sharing why you supported Wyoming County Healthcare Center early on and the simple steps families can take to be ready for emergencies and tough, unexpected moments. Signing off, Aiden. Thanks for watching Health Matters. Subscribe to follow the series as we spotlight the partner organizations based in the building and the people behind the work. For updates, programs, and resources, visit Wyoming County Healthcare Center online and follow us on Facebook. Bob, can I tell you a joke?
I would be really disappointed if you didn't tell me it.
When do doctors get mad?
I don't know. When do doctors get mad?
When they run out of patients.
Like a brick wall. I should have saw that coming. Well done.
I'm Aiden. Next time.